What's going on, everyone? Dr. Tom Walters from Rehab Science. Thanks for coming back to my channel. Today we are going to look at a super common complaint, which is mid-back or thoracic spine tightness. It's going to be this region mainly between the shoulder blades, even extending down a little lower, but an area where a ton of people have pain and tightness. So we are going to look at a few exercises to help with that. Let's check them out. So as I mentioned, today we are going to look at the thoracic spine. The thoracic spine is the mid region of your back. So if you think about, you've got your neck, which is the cervical spine, 7 vertebrae there. And then we get into the thoracic spine, which is 12 vertebrae, which again, sort of the mid-back area of your spine. And then again, down at the bottom, we have the 5 lumbar vertebrae. So we're going to talk about this mid-back region. It's the area of your spine that has this natural rounded curve or kyphosis, whereas your neck and your low back have a lordosis or an inward curve. So it's the one area along with the sacrum down below that curves out and forms that kyphosis. We think about it, when people are sitting and have sort of a rounded posture, they might exaggerate that kyphosis. So we are going to look at exercises to help improve mobility here. This area of your spine is naturally less mobile because your ribs attach to it. So that area is meant to be less mobile, more stable to protect your organs and to keep your rib cage solid. But in cases where it's maybe more stiff than we want it to be, it can cause pain, especially between the shoulder blades in that mid-back region. So we'll look at exercises to help improve mobility there and reduce pain. For the first exercise, we are going to use a foam roller. Just in case people are looking for tools, I partnered up with OPTP to create a Rehab Science Essentials kit. I'll put a link down below, but the foam roller is one thing you'd get in that kit. It's just really a kit of the most common rehab tools that I use. So this is just a standard foam roller. You can order them on Amazon, anything like that. But what you're going to do to loosen up your thoracic spine is put it on the ground. It's going to run perpendicular to the length of your spine. You are going to sit in front of that foam roller and kind of hold on to the ends, lay back on it so that it kind of hits the lower part of that thoracic spine. You can hold your head with your hands or across your chest. But what you're going to do is push up into a bridge and then just roll along your thoracic spine. That pressure into your mid-back will help to mobilize the joints and soft tissues, the muscles that run along the spine, and will help encourage spinal extension, which is sort of a straightening of that normal rounded kyphotic curve you have in the thoracic spine. So we're going to start here, just roll up as far as feels comfortable, and then roll back down. You can just do this I'll usually tell people, just roll up and down every day for somewhere around 1 to 2 minutes to help reduce pain in the mid-back and again to help improve mobility. So that's the first one, a foam roller thoracic extension mobilization. The second exercise is going to be another one to help again improve mobility in the thoracic spine and encourage thoracic extension. This is just an awesome stretch if you feel tight in your mid-back. You can take breaks if you work at a desk or a computer. You can do this throughout the day. I'm going to use a ball to do it. You can also do this on a countertop or a table. You don't necessarily have to have a ball. So what I'm going to do is put both of my hands on the ball, and then I'm going to reach forward and roll the ball, and as my shoulders go up, my back, it's going to stretch my mid-back into extension. So I'm just going to kind of go up and down like that to dynamically mobilize my thoracic spine into extension. Again, if you just have a table or a countertop, just slide your hands out on the table, and the main thing is to stretch down this position and then come back up. This is one you could do 5 to 10 times periodically throughout the day to help reduce mid-back tightness and improve mobility. Okay, so that's the second one, a dynamic thoracic extension mobilization. For this next exercise, we're going to use our foam roller again. This time, instead of having the foam roller perpendicular to our spine, we're going to have it in alignment or longitudinally running that direction with our spine. What you're going to do is sit on the end of it. So your whole spine's going to be on here all the way from your tailbone to your skull. So let's make sure you get in the right spot. You're going to lay back slowly Make sure your head, like I say, your whole spine is on the roller, and then you'll have to use your legs a little bit to balance because it's going to want to roll a little bit. What we're going to do is, while laying on the roller like this, we're going to do what we call angels. So you're going to come out to the side, up all the way overhead, and then back down. This will help to stretch the muscles and tissues on the front of the chest wall, so mainly the pecs, which in doing this, as we stretch those tissues on the anterior side of the rib cage, it will help us to sit upright more, just to lengthen those tissues, which will help with getting us out of those rounded postures and encouraging extension in our mid-back and our thoracic spine. So just another one that's really great for just working on mobility and reducing pain through that mid-back region. Okay, so on this one you can just run through 10 to 20 repetitions, a few times throughout the day when you're feeling tight. Okay, so that is the angel exercise on the foam roller. So the first 3 exercises were all mobility focused. This last one, we're going to use a resistance tube. This is in the kit I mentioned before. Again, the link is down below, so if you need these tools, it's in there. We are going to use this resistance tubing to help encourage strength of our rotator cuff and the muscles that pull our shoulder blades back, which will help with bringing us out of these sort of more kyphotic, rounded thoracic postures into a more extended upright position. So what we're going to do is we're going to hold that band, hands, palms facing up, arms pointing straight out from your side, and you are going to what's called external rotation. We're going to externally rotate the shoulders and pinch the shoulder blades in the back. So before I start that movement, I'll kind of turn so you can see. I'm here in my relaxed position. I'm going to set my shoulder blades back into retraction, tuck my chin, and then externally rotate the shoulders, hold there for 3 to 5 seconds, and then relax. Okay, so all those movements are working together. A little bit of a chin tuck, external rotation, and scapular retraction, working our rotator cuff and the muscles that attach our shoulder blades to our spine. Okay? Try not to just arch your low back and let your rib cage flare out. So you can kind of tuck your abdominals in a little bit, tuck your chin, and then externally rotate your shoulders and pinch your shoulder blades. Okay, so that is the last exercise. We worked on mobility in the first 3. This last one is going to help us engage and activate those muscles that pull our posture back into scapular retraction and thoracic extension. Again, another good one for using periodically throughout the day if you're finding yourself chronically in these rounded positions and having some discomfort there. So give these a try, and as always, let me know if you have any questions in the comment section. Okay, talk to you later. Bye.